Let's start with a story. Imagine you're a parent and your baby suddenly stiffens, their eyes roll back and their body shakes. The seconds feel like hours. You panic, not knowing what to do. First, take a breath. Most childhood seizures, especially those linked to fever, resolve safely and don't cause lasting harm. But a few do signal something more serious. This video will help you know the difference. Seizures are sudden, uncontrolled electrical disturbances in the brain. In children, the most common are febrile seizures. These happen when a child has a fever, usually between 6 months and 5 years old. Febrile seizures are scary, but most are brief and harmless. Afebrile seizures, on the other hand, happen without a fever and may be a sign of epilepsy or another underlying problem. Infants are more vulnerable because their brains are still developing, and their bodies react differently to illness and injury. So, when is a seizure an emergency? Remember the 5-minute rule. If the shaking lasts more than 5 minutes, call emergency services. Other red flags include, if your child has trouble waking up after the seizure, if one side of their body is weak, if they're younger than 6 months, if they have a stiff neck or high fever, or if the seizure happens after a head injury. These signs mean your child needs urgent medical attention. In the emergency room, doctors first make sure your child is breathing and their heart is beating normally. They'll check blood sugar, look for signs of infection, and may order blood tests or a lumbar puncture if they suspect meningitis. The team will ask about the seizure, how long it lasted, what your child was doing before, and if they've had seizures before. This information helps guide the next steps. Not every child with a seizure needs a brain scan. For simple febrile seizures, imaging like CT or MRI is usually not needed. But if the seizure is complex, lasts a long time, or your child has unusual symptoms, doctors may order imaging. CT scans are quick and good for finding bleeding or fractures, but they use radiation, about the same as 2 months of natural background exposure. MRI scans take longer, don't use radiation, and show more detail, but young children may need sedation to stay still. For newborns, a cranial ultrasound is a safe bedside option. No tunnel, no noise, just gel and go. After a seizure, your child may be prescribed rescue medication like intranasal midazolam for future emergencies. If the seizure was complex or unprovoked, your pediatrician may refer you to a neurologist for further testing. If an MRI shows an abnormality, your child might need developmental screening or additional care. Most importantly, keep a record of what happened and follow up with your doctor. The future of seizure care is bright. Artificial intelligence tools are being developed to help doctors decide which children need MRI scans within minutes of arriving at the ER. Newer MRI machines, 3 Tesla and even 7 Tesla, can spot subtle brain changes that older machines might miss. These advances mean more precise care and fewer unnecessary tests. Here's what to remember. About 1 in 3 children who get an MRI after their first seizure will have a finding that changes their care. Call for help if a seizure lasts 5 minutes or longer, or if your child has any focal symptoms. Imaging decisions depend on the seizure type, your child's exam, age, and risk factors, not just fear. A simple fever-related shake under 15 minutes is scary but usually harmless. Scans won't help and may even harm with radiation. MRI is our Sherlock Holmes. It sees hidden scars or malformations invisible on CT without radiation. In babies, a quick bedside ultrasound can catch a bleed in minutes. No tunnel, no noise, just gel and go. If the seizure keeps going past your favorite pop song's length, that's your cue to dial emergency services. Empowering parents with clear criteria for urgent care and demystifying the imaging toolbox can reduce anxiety, prevent unnecessary scans, and help children get the right treatment when they need it. With science-backed guidance, you can feel confident and informed.